use the inhalers, dry powder inhaler or MDI, meter dose inhaler, like very elder, where the coordination is poor, or very young, the person like children who cannot use that inhalers, the nebulization can be considered. Or mentally retarded patients also can be considered for nebulization. Then what is the term home nebulization? A person who needs persistent nebulization, frequent nebulization for more than 2 weeks, then he can use the nebulizer at home itself. That is called home nebulization. The post-COVID era, this home nebulization concept is more famous and very useful for many of the patients. What are the available solutions for this nebulization? For exacerbation, we can use the bronchodilators like inhaled corticosteroids, budesonide, beclomethasone, flunisolide or fluticasone can be used. Among beta agonists, salbutamol, levosalbutamol, formoterol, arformoterol are available. Among the antimuscarinic agents, ipratropium bromide and clicopyrronium are available. What type of nebulizer to be chosen? That is the question in front of patients. There are 3 available nebulizers. One is jet nebulizer, another one is vibrating mesh nebulizer, the third one is ultrasonic nebulizer. And jet nebulizer is a simple one, electrical device based vibration. It will be creating the aerolization of the molecule. In ultrasonic nebulization, the ultrasonic waves are used to dissipate the molecule, medicine will be delivered. In vibrating mesh, the mesh will be vibrating by ultrasonic wave, it will be giving the molecule. Jet nebulizer is a easy one, easy to carry. Mesh nebulizer is a better one, but it is costly. Ultrasonic nebulizer also is a simple one, but suspensions cannot be used along with this ultrasonic nebulization. For example, budesonide solution is a suspension. While using, the efficacy of the drug will be varied. It is better to choose jet nebulizer at all the time. In case the nebulization, home nebulization can be done at home along with oxygen cylinders, then oxygen driven nebulization also can be done. What is the volume of solution in that medicinal cup? Volume should be at least 4 to 7 ml. That is the ideal one. If it is lesser than that, the efficacy of the medicine will be low. The residual volume of that particular mask will be mentioned in that manufacturer's note. If it is not there, the ideal volume should be 4 to 7 ml. If the medicine is less than 4 ml, then you can add normal saline along with that. If normal saline is not available, you can use freshly prepared RO water. If that is also not available, then you can use simple water bottles recently opened. 3 to 4 ml of medicine can be added along with that. So, what is the duration of nebulization? It should be taken for 7 to 10 minutes, not beyond 10 minutes. In case oxygen driven nebulization, home nebulization is taken, the oxygen flow should be 6 to 8 liters. If the patient has exacerbation, then more than 10 liters of oxygen is needed. That is not possible all the time at home. After 10 minutes of nebulization, the residual sample should be discarded. Whether to add 2 medicines in a single chamber or not, that is the question in front of patients. The solution and suspension cannot be mixed up all the time. The manufacturer's advice should be followed. Generally, if you don't know if there is no manufacturer's advice, then it is better to avoid mixing up of 2 medicines to be taken at different times. While taking the nebulization, the patient should close his eyes, because if he is using beta agonist, it will be increasing the chance of glaucoma. If he is using ipratropium like antimuscarinic agent, that will be giving the blurring of vision. So it is better to close the eyes. Whether the nebulization to be taken only through the nasal route or through the oral route also. If the patient is taking through the oral route, it is better, because the delivery will be more with the oral route. So the patient should take the nebulization along the oral route. They should behave in this way, or through the mouthpiece of nebulization can be also used for better delivery. Nebulization has been taken for 7 to 10 minutes, the residual is discarded, the patient has closed his eyes, he has taken the nebulization through his mouth, things are fine. Then how to disinfect this particular mask? After every use, the mask should be cleaned, disinfected, because the contamination chance is high with nebulization. It will be giving the risk of infection in the next time use. So before using the next time, it should be cleaned with normal saline at least. If the same mask is used for another person at clinic or the family members, then how to clean it? Simple thing is, it should be soaked in the boiling water for 5 minutes. That is adequate. If it is not possible, one portion of vinegar and 3 portions of water containing solution, it should be used to disinfect it. Bleaching powder based solution also can be used to disinfect it. Microwave based heating of mask is also indicated. Once the doctor has advised home nebulization, certain things to be considered, like what type of nebulization the patient is going to take, what is the machine the patient is using, what is the residual volume of that particular mask, how much time to be taken to be advised to the patient, how to clean the mask to be advised by the patient. If the family members are sharing the mask, then how to clean the mask or disinfect on the mask, that also to be noted by the patient. Thank you.